Hi, my name is Shannon. I am a doctorate student here at Indiana State, and today I'm going to be talking to you about about integrating whole body approaches to clinical evaluation and using myself as a reference. So let's get started. So the whole body approach. So to the left is kind of what I currently am doing in my own practice, and then to the right is some gaps or some areas of improvement that I'd like to work on. So first, starting with what I do right now. So with whole body approach, I like to work the kinetic chain. So if there is a lower extremity injury, checking hip alignment, because that is crucial, or very likely that if hips are off, if the hip alignment's off, or if a hip is stuck in rotation, then the rest of the kinetic chain going down to the lower extremity of the ankles could possibly experience injury. Also, going up the kinetic chain, so if the hips are off, then core, there could be erector spinae tightness, shoulder compensation as well. Also for a whole body approach, maybe not thinking or trying to think a little bit more outside of the box, I also like to consider nutrition habits. A lot of the time, some of the things that our athletes or patients are eating has a huge factor in how they're feeling. So when you have a patient that's saying, hey, I don't feel right, hey, I have a side cramp, and then ends up being that, maybe their nutrition isn't really helping movement in their digestive tract to help with that internal medicine. Also sleep patterns. I like to take into consideration sleep patterns for injury. So we do a lot in our sleep. We spend a lot of time sleeping, and if you don't know that if you haven't realized that you sleep with your right arm on top of your head or above your head, and then you slowly start getting right shoulder pains, your sleeping patterns have a huge factor in possible injuries that you have. I know me personally, I've had a couple cases of dealing with a patient who slept with her arm over her head, or like beneath her head when she sleeps, and then also had another case with a girl who gripped her toes or like clawed her toes in her sleep and slowly started having some sesamoiditis in her great toe. So trying to think outside of the box of it doesn't always have to be a sport related injury, but and then also it could be affecting the whole body of something so simple as nutrition and sleep. And then also core activation. I am a huge supporter of core activation throughout movement, especially in those diagonal sports of tennis, swimming, and baseball, softball. So making sure that the core is activated and properly contracting during these complex diagonal movements. And then, so those are the main, or those are some whole body approaches that I take to my evaluation, and I like to ask those types of questions in my evaluations. But then to the right, if you look, there is some areas of improvement or filling the gap of gait analysis, navicular drop test, proms, using proms more in my evaluation, as well as having a more psychological approach to my evaluation. So with all of this, filling the gaps and areas of improvement, I did some reading, research, some articles. So the first one is risk factors that contribute to medial tibial stress syndrome in runners. So this past year I had a lot of MTSS issues and cases, so I wanted to also take into consideration of risk factors or predisposing factors that a patient might be prone to. So In this article, they found a significance in the navicular drop test, and how that test, if you test positive, you are more likely to sustain MTSS injury, as well as pronation, if you have an increased pronation, and increased plantar flexion. Participants in these studies who had all three of these were very likely and highly susceptible to MTSS injury. So the next article that I looked at for bridging the gap of my whole body evaluation is looking at, again, gait analysis of the lower extremity. And so in this article, they looked at gait analysis, and they found that increased pronation, that consists of eversion, abduction, and dorsiflexion, those participants had a high risk of exercise-related lower leg pain. So in this situation, they looked at a bunch of runners and found that if the participants had any abduction in their gait, is significant of dorsiflexion, and eversion and pronation as well, that they were more susceptible to lower leg pain, especially in those high mileage runners. All right, so the next article I looked at was for the more psychological approach. So this was the PHQ-9 PROM, and here it's more for depression, for participants with depression, high severe depression, and I wanted to bring light to this because it did have great numbers for sensitivity and specificity, but also kind of just reminding myself, especially this past week with a previous assignment, just talking about and noticing people's feelings and noticing people's response to things. And I think that even though depression and severe depression is seen as maybe not as likely in the athletic population, but still being aware that it is 100% around in this population. And then also using a general health questionnaire. So not specifically in this article, but just kind of relating back to myself as a clinician of wanting to use, obviously, if it's a specific area that we can focus on within, using a lower leg index, or using an oswestry for low back pain. But remember, just using also just general health questionnaires there's a short form, 36 and I believe 9. So there's plenty and tons of questionnaires out there of just general health that we can use for our patients, so we can kind of get just a general idea of how they're feeling about their own selves, especially as they're injured. So last article is another PROM that looks at the fatty and the fatty sport in relation to each other. So in this article, they found that the fatty and fatty sport are reliable in detecting functional limitations, sensitive between healthy and limited individuals, and responsive to improvements in functions after rehabilitation. So in this article, what I got out of it at least was that I should be using the fatty for my patients that are having lower leg or foot and ankle injuries. Currently, I have one foot case, so I think that using a PROM like this would be a great way to enhance myself as a clinician, using these outcomes to increase patient and clinician relations, and as well as using these for myself in clinical outcomes. Not as clinicals and objective measures, but using them for my own clinical practice. So kind of just concluding to what we talked about today, is bridging the gap for myself as a clinician in using the navicular drop test as a way of predicting lower leg injury, and then also doing gait analysis, and then looking at general health questionnaires and psychological questionnaires for patients, and then last using patient-related outcomes of similar to the fatty or fatty sport for myself for lower leg injuries. Thank you so much for listening.